country is already speaking with a number of COVID-19 vaccine developers in hopes of getting immediate access to successful vaccines. On Friday, country representatives had a back-to-back meeting with vaccine developers Pfizer and those in Russia. Caroline Bonkin has an update about those meetings. Caroline, what was discussed?
Well, the Philippines won't participate in the clinical trials for Pfizer's COVID-19 vaccine since they're already nearly done. Results will be out in October, but the country may still have access to it. In a meeting on Friday, health spokesperson Maria Rosario Vergere said Pfizer officials have asked Philippine representatives for the number of vaccines that the country would pre-order. Philippine officials have yet to talk about it in line with the procurement law, but before negotiations can proceed, both sides need to have a confidentiality disclosure agreement. The same holds for negotiations with another vaccine developer, Moderna. As for Russia's Sputnik V, our vaccines experts panel has some clarifications on documents submitted by Gamaleya Research Institute. The response has yet to come. Officials are also in talks with the Australian government for a vaccine being developed by the University of Queensland. Back to you.
Caroline, basically you're saying negotiations cannot proceed without a confidentiality disclosure agreement between the government, the Philippine government, and a vaccine developer. Why is that?
Well, it contains the agreement between two parties to make sure that all privileged information that will be shared during the negotiation will remain confidential. During this phase, the developer will share details about the vaccine and other sensitive information. So it's a safeguard measure on both sides. Yeah.
Caroline, UP Okta researchers saying the country has already begun flattening the COVID-19 pandemic curve. Does the health department agree?
The media asked Health Undersecretary Vergere about it earlier, and she said health officials don't really want to say that the country is flattening the curve, so the public will not be complacent. But Vergere said figures show improvements in the COVID-19 response. She explained that having a flat curve means that the number of cases will not overwhelm the healthcare system. And currently, most of the hospitals in Metro Manila, Calabarzon, and Cebu province, which hit danger level back in July, have slowly been decongested. Only 64.7% of COVID-19 hospital beds in Metro Manila are in use. That's lower than the 80% utilization rate back in July. The reproduction rate of the virus is 0.97, which means a person with COVID-19 disease can infect less than one person.
Sinasabi nga ng WHO and other reputable international organizations no na kapag ka less than 1 ang transmission rate mo, nandun ka doon sa tamang direksyon no, at maganda ang indikasyon para sa response nyo.
Vergere said this may be attributed to the 2-week modified ECQ in August and the implementation of the hospital and quarantine site referral system. Pia.
Caroline Bonkin there reporting.